Okay, we're live now, Chair. Thank you.
Okay, good morning, everyone, and welcome to the Adult Social Care Scrutiny Panel meeting. Today we have in attendance Eric Scully, Director of Adult Social Care and Health Integration, Michelle Dawson, Age and Better Middlesbrough Manager. We have Councillors Jones, Purvis, Walker, Wilson and Rooney. And also in attendance we have Susie Blood, Colin Breheny and Michelle Jacqueline from Democratic Services. I'm Councillor Platt, the Chairman of Adult Social Care Scrutiny. Also today, we will be observing a 2-minute silence at 11 a.m. to remember those who lost their lives in conflict. Susie will interrupt proceedings just before 11 so we can remain silent. Thank you. Right, have we any apologies for absence, Susie?
None received, Chair.
None. Any declaration of interest? No. Minutes of the last meeting held on the 14th of October. Can we have someone to say that those were correct? And a seconder, please.
All correct as far as I can see, Chair.
Thank you, Councillor. Thank you. Right, we're going to item 4 now, which is Age and Better Middlesbrough. And we will call on Michelle Dawson to give us, who is the Programme Manager, and she will give us her, I'll go over to you, Michelle, sorry.
Thanks, no problem. A presentation, I believe, that might appear on your screens soon, hopefully.
Yes, I'll just share that now. Thanks, Michelle. Thank you, Chair.
While Susie's just sorting out the presentation, I can't see that, Susie, but I'm sure. Oh, there it is. Brilliant. Fab. Okay. So my name is Michelle Dawson. I manage Aging Better Middlesbrough. I work for Middlesbrough and Stockton Mind. I'm part of the senior management team. I've worked there for the last nearly 10 years. I can't see the presentation, but will it appear soon, Susie? Possibly. Susie, do you want me to bring it up on my screen? Would that be better? Oh, there we go. Just taking a little time.
Has it come up now? Sorry, I do have a bit of a difficulty sharing screen sometimes. Has it come up?
Yeah,
yes, we can see it, Susie.
Thank you. Sorry about the delay.
No problem. From the first slide, if that's okay. I think we haven't got the, yeah, you're going to get the slideshow, but I'm sure that
I shall hopefully be able to do it if you just bear with me. It does seem to, I just seem to have a bit of an issue with my machine. It seems to be on a time delay, so I do apologise, Michelle. So hopefully here we go.
No problem. It's absolutely fine. I mean, the slides are really only there to keep me on track. Otherwise, I'll talk about this stuff like forever and ever. Oh, I've lost it now.
It should be coming in. There we go.
There we go. Okay. So Aging Better Middlesbrough, for those of you who might be new, is a 6-year lottery funded programme. It's what the lottery calls one of the strategic lottery funds. It was £6 million over 6 years to reduce loneliness and isolation for older people in Middlesbrough. The programme launched in 2015 and was due to end in March 2021. So this is year 6. The learning is underpinned by the project is a learning project. So really, it's what the lottery calls a test and learn project. We were about learning as much as we could about what works to reduce loneliness and isolation for older people. And in that sense, the whole aim of the programme was to create evidence, because there was at the time very little about what worked. The programme is also co-designed with older people. So at every point, we work with older people to design solutions, to make decisions and all of those sorts of things. We have accrued loads and loads of learning about loneliness, about older people, older people living in local communities, about commissioning for loneliness, partnerships in the third sector, and lots of other things. And Aging Better Middlesbrough's website has a learning page which has all of the learning documents, not just locally, but nationally, because there are 13 other Aging Better areas in the country, all of whom have spent close to 6 million. Manchester got £9 million to understand what works to reduce loneliness. And between all of those 13 areas, 6 years and £114 million, we have a lot of learning about what works. Specifically, we understand about loneliness in Middlesbrough. We have worked with thousands of older people, and our sort of speciality locally, more by accident than by intent, is around understanding chronic loneliness and older people with multiple health, physical and mental health needs. So I think because of the people that we attracted to the programme, and because of the support that we provide, and also possibly because we're a mental health organisation leading the programme, we have lots of learning around what it means to work with older people who have complex physical and mental health issues, or who we would class as chronically lonely, which is different to transitional loneliness, and they're not the same. And that's specifically relevant around COVID, whereby older people might find themselves lonely in a transition. So because their environment has changed, or because they transitioned from one life experience to another, but isn't the same as working with people who are chronically lonely, so who've been acutely lonely for long periods of time. Next slide, please. So I could go through all the activity of the programme and the different things that we've tested, tried, delivered, but that would be another whole 20 minutes of presentation. So we've delivered a whole load of interventions over the last 5 years around long-term mental health interventions, asset-based community development, peer befriending projects, projects within the BME community, digital support for older people, projects with older Pakistani women, projects with asylum seekers and refugees, small grant projects around exercise, dance, if you name it. If it's to do with older people and reducing loneliness and isolation, the likelihood is Aging Better has tried it or has some learning around it over the last 5 years. When COVID hit, obviously, like everybody else, everything that we did had to change. This is an overview slide of what we did. So Eric phoned me up and said, can you provide a point of contact for people who are coming through Help Borough and the isolation hub? What did you call it? People who were people with complexities who were told
shielding.
Shielding. That's it. Shielding. God, that word. We haven't heard that word for a little while, have we? The shielding hub. Thank you, Eric. So Middlesbrough and Stockton Mine became a bit of a destination point for people coming through those kind of more broader responses. And Aging Better Middlesbrough formed a kind of partnership project to deliver then telephone befriending. We also phoned about 600 of the older people that we were in regular contact with to check they were okay, and to engage them in longer term telephone support where they had additional needs. We delivered wellbeing packs, activity packs to older people. We provided a lot of digital support. So we have a digital support project. We bought digital devices with our money and gave them to people, and we bought data to enable those older people to use those digital devices in their homes, whilst also linking them with digital befrienders to support them to build confidence around how to engage with digital technology. We launched, so Middlesbrough and Stockton Mind, which is supported social prescribing, is delivering social prescribing, but Aging Better Middlesbrough also invests in social prescribing financially. We launched social prescribing on the 1st of April in the middle of COVID to support GPs to enable them to refer patients who might have a need for additional social support into their social prescribing link workers. And the Age Friendly Middlesbrough project, so a girl called Anya who runs that project, she spent the last sort of 6 to 9 months connecting, mapping and building partnerships that enable some of the mutual aid groups and smaller community groups to connect with each other and kind of find ways to not duplicate and to share their resources and those sorts of things. Next slide, please. Thankfully, the lottery started talking about not ending Aging Better in March 2021. So we would have been due to end in March next year. And I think because they recognise that actually we will play a crucial role in supporting older people at the time to recover from COVID, which was the language being used in June last year. We're not using recovery language anymore. But yeah, there was a recognition that it would be useful to continue on with Ageing Better Middlesbrough. Unfortunately, they didn't give us another £1 million for year 7. We got less than half of the money for year 7, so we've had to prioritise the delivery of what we're going to do from between now and March 2022, which is when the programme will now officially end. So we are going to continue to provide one-to-one holistic support to older people, to lonely and isolated older people, until the programme ends. At the moment, we're calling that Telephone Support Plus because predominantly is telephone support at the moment, but in the longer term, that will be quite a flexible outreach project that will provide holistic support, person-centred support to older people. It has a particular slant on supporting those older people to improve their physical health. So we're hoping to link them more robustly into the MDT SPA, the Falls team, and into kind of physical activity. Because, like we talked about at the beginning of the meeting or before the meeting started, the issue around physical health and deconditioning for older people is something that's really we've really noticed specifically over the last 6 months. We are still going to provide our digital support project to older people with an expansion of that digital support into BAME communities. So we are providing the resource for IPC, Investing in People and Culture, to recruit and additional resource to support a digital project through IPC to work with BME communities in Middlesbrough, or at least some of those communities in which that organisation has particular reach. We know that BME in Middlesbrough doesn't mean everyone, but we're going to try our best to start working to engage more people who are not white British into our digital support project, because at the moment it's pretty not very diverse in terms of its reach. We'll continue to fund the falls prevention strategy. You're probably not aware, but Ageing Better funds a backfill of a quite high-grade occupational therapist into the falls team in order to free up the falls team to deliver on the falls prevention strategy. We are continuing to fund Age Friendly Middlesbrough, well, the officer that runs Age Friendly Middlesbrough, to continue to do the mapping, connecting and capacity building work. We are expanding the mental health therapy that we deliver, which at the moment has waiting lists and there isn't enough of it. And we are continuing to do the development support to social prescribing. So that's what we're doing over the next sort of 15, 18 months. Next slide, please. In the last 9 months, I think the partnerships that are kind of being built around working with older people have become much stronger, especially with health organisations. We created the Digital Development Steering Group, which I chair, to start tackling the digital divide in Middlesbrough, which is pronounced and a massive issue that everybody really should be addressing and investing in, but nobody is. So we formed a partnership to bring people around the table to start figuring out what we could do to help. We've attracted £20,000 of funding to develop an online platform that will enable businesses to donate devices. We will have them refurbished by the private sector. They'll keep 50% of those devices and donate 50% back to the online platform, where organisations will have a login to be able to apply for devices for their service users and groups in the community. We're also looking at the available support for people at all age. It's an all-age digital development steering group to be able to access digital support. And we are looking at the connectivity element, and we're working with 13 and the Tees Valley Combined Authority and other people to try and understand what the offer around connectivity for people in Middlesbrough will be in the future, and what we might need to bridge the gap until some of those solutions are fixed. That's a whole other presentation, but again, I can talk to you about that. Falls prevention strategy. So I chair the fall prevention. I co-chair the falls prevention steering group now. Which is a really exciting strand of work because it's put Ageing Better and Middlesbrough and Stockton Mind in touch with health partners that we otherwise probably wouldn't have started working with. And we created an informal partnership a few weeks ago around supporting older people through the winter in partnership with You've Got This, to look at what is available for older people through the winter. How can we share our resources and information about what's being delivered and work better together to support older people? So a little bit, the last 4 bullet points are around actually the stuff that's the stuff that's required and currently not being probably done, or should be done, or could be done if we were looking at a kind of utopia vision. And that would be a single point of access for the support available through the third sector and communities for older people. We know the Help Borough line and the Shielding Hub worked really well. It was a really great way to get people access to the support they need. And in our mapping document that we have around everything available to older people, there are like hundreds and hundreds of different people and phone numbers you might need to contact if you were trying to get access to support for different things. You could phone one person to get an art activity pack delivered to your house, but you'd phone someone else if you wanted to get a slow cooker delivered to your house, for instance. And they're 2 entirely separate numbers, and you'd need to know about both those organisations and both those numbers if you wanted to access it. So there's something around joining things up locally, and there is whilst we're doing our best, there's still not a strategy to join up the support available to older people, and that is a gap. And we feel like it needs more investment and more support across the sector, across all the sectors, including the local authority and CCG and public health. We need long-term investment in digital development. 72% of the people who contacted just to repeat that, because I think that's extraordinary, 72% of the people who most needed help when we went into lockdown had no access to the internet. We have our local health trusts, GP practices, and to an extent public health and the local authority doing their best to try and digitalise as much of the care we provide to people as possible, whilst not investing in the required amount of support to get people who need help the most onto the internet. It's expensive, it's complex, it's in everybody's too hard tray. And there isn't enough telephone support available to people, even with Ageing Better's resource. Age UK have got resource to do telephone support, but still we don't promote what we do because at the moment it's at capacity, and we know that if we just happen to tell 6 or 7 health teams about befriending and telephone support, that the demand would outstrip our ability to meet demand. The other issue that we have is the gaps that will be left when Ageing Better's gone. So whilst I appreciate that within scenarios like this, that it's, defaulting to Ageing Better is useful, because we are doing loads of work, and we've been doing it for 6 years. By next year it'll be 7 years. I am a little bit scared for some of these partnerships and some of this work when we're no longer here. That's the end of my presentation.
Thank you, Michelle. Now we'll take questions, but I have a quick question for you, Michelle. You're trying to get the older people online, obviously, which is very commendable. But in my opinion, the old people are vulnerable when they go online. So what steps have you taken to ensure that they don't get hacked?
So we have digital support available to older people to help reassure them about the steps they can take to protect themselves from online scammers. We have partnerships with the police that provide sessions around online scammers. Some of the digital support attaches people to an online Google learning platform, and on there is resources available to people to support them to reduce the risk. And you say of being hacked, actually we're not asking people to, we're not supporting people to get online to put all their banking online. We're supporting people to get online in order so they can access Zoom, so they can connect with other people. Our priorities are about loneliness and isolation. It's not, we don't advocate getting older people online in order with an agenda that's around finance or any other things. It has to be on the motivations of that particular older person. So they have to find a reason to get online, and then you support them to do that thing. So we're not asking older people to get online with all of their financial details. The risks of hacking through something like creating an email address so you can have a Zoom account are relatively low. It's not my area of expertise. We commission it out to the Hope Foundation, who do a really great job.
Okay, thank you. Councillor Walker wants to ask a question.
Thank you, Chair. Yeah, I mean, you're right. It was a worry. We actually got, as a family, we bought my aging mother, who's 94, a portal, and she's using it brilliantly now. I mean, it took a bit to just to get them on it, you know. I mean, to instruct people over the phone is not easy, but when it's an older person, it's even worse. It took a while, but through our own resilience as a family, we actually managed to get her. And now she pops into many conversations without us realising. Suddenly she's there.
Yeah.
You know, so a lot of people, and it has helped in a lot of ways. And I know a lot of people have actually accessed those portals. They are slightly expensive to start with, but they're vary in sizes, and that means that although she's online, she's not, as you quite rightly, as Jim pointed out, she's not vulnerable to any hacking of anything. So that is one thing that we feel quite safe in. So that's one area that I think a lot of people can actually buy into as families as well. I think portals are brilliant.
That technology does exist. I think when I'm talking about the digital divide, I think I want to be really clear that it's not just about older people.
No, I know. Yeah.
So,
it's like young people, But I mean, what I'm worried about, as you quite rightly pointed out, is what's happens when you've gone. I mean, you're trying to set all this up, hopefully in preparation for when you're not there as an organisation, that organisations will carry this forward. So do we need some kind of statutory investment into this area of concern for older people and generations of people in the future? Is that what we are asking for now?
I think rather than I'm generally not a person who would say actually what we need to solve this issue is just loads of money. That's probably, yes, to an extent money really helps, but I think what's really important is there to be leadership locally and strategically that connect the sector across the work the partnerships that we're in, health, social care and public health, around being able to make decisions around investment that bridge all of those gaps in a way that's a little bit more kind of overreaching and with a slightly bigger vision than we have now. So I think yes, there'll need to be, if you want to continue doing some of this work, that it would need to be funded. I think stuff around telephone support, probably that stuff you could probably put a really strong case together as to why it will always be useful to older people with or without a pandemic. And we have evidence to suggest it's a really effective way of engaging older people to do other things, because the first thing you need to do if you're lonely or isolated is build a relationship with someone. All of the community activity in the world will not solve loneliness and isolation. You have to build a relationship with someone. They have to trust you. You've got to build confidence, and you need to be a trusted voice in their life. It's not about, I can't stress enough that loneliness and isolation isn't about access to information and community activity. Whilst that is an element, without the bridging people, your telephone supporters, your social prescribers, your social workers, your outreach workers, without those bridging people, the lonely people will never get to the community activity. So it's really important that people don't feel like the solution to loneliness is lots and lots of activity in the community, because only the non-lonely people will go. And in the main, they'll only be white British. In the main, they'll only be white British retired professionals. So we can't forget about the reach in relation to other parts of our communities. Sorry.
Yeah. I mean, I completely agree with you there, because can I just add on to that, please, Jim? Just a second. It's just that I know personally that people can be in a room full of people, but there can still be that loneliest person in that room. So it's how we address that. And I don't know. I mean, if we've got a magic solution, anybody here today?
Yeah, we do.
That would be
brilliant.
Magic
solution. There is a magic solution to long-term loneliness, and that's access to non-time limited mental health support.
Yeah.
It costs about £4,000 or £5,000 per person per year. And I would love to see someone who's actually going to fund that in real life, because it's really expensive to tackle loneliness, especially chronic loneliness. Social isolation is an entirely different thing, and it's really not useful to have them both in the same sentence, but it's easier as a conversation. But they're not the same. When you're right, they are very, very different.
Thank you.
Councillor Rooney, you had your hand up before Eric, so go ahead, Councillor.
Right, thank you. Thanks, Michelle. I was interested in one of your earlier points in your presentation about the barriers to digital support for BME communities. Why have you singled that out? I would imagine language is one of the areas, but was there other factors?
We singled it out because we've been delivering digital support for 5 years and we've barely engaged any older people from the BME communities.
And do you know why? Oh.
I think our learning suggests that if you're delivering community activity and you would like to engage with marginalised communities, whichever parts of the BME community or other marginalised communities, you need to do something that is tailored, specific, targeted, and with the organisations or people that have reach and relationships within those communities. And as we haven't done that, I would suggest that's why we haven't engaged those communities. As in, we didn't try hard enough and we didn't invest any money in it specifically. The assumption that if you put a service out there that you will just engage the people who need it is not accurate. If you want to engage particular marginalised communities, you've got to try really, really hard with particular kind of planning and elements in that project that enable you to do that work.
Okay, thank you.
Okay, Eric, would you like to come in?
Thank you, Chair. There's just a few things I'd want to say on this subject. I would absolutely and without exception endorse everything that Michelle has said. Michelle is so passionate about this and so disarmingly blunt and to the point that I think it's a great way to discuss the subject. One of the things that's really important about the marvelous work, and it is marvelous work that Aging Better in Middlesbrough has done and continues to do, is the thing about the test and learn, that it's evidence based, that it's quite often I find myself having conversations with people about loneliness and isolation, and the potential answer is to put on social activities and whatnot, and that's to miss the point completely. One of the real strength and the beauty of Aging Better is that they've been working with such coverage and for such a protracted period of time that when they say something, it's evidence-based. So if Michelle says there's a gap, there's a gap because they've tested that and identified that. And some of the solutions are counterintuitive. You know, some of the stuff is not what we expect to find about loneliness and isolation, but Aging Better has been working with sufficient sophistication to bottom that out. So the knowledge that they have, the expertise they have is really precious to us, and we need to make sure that we hold on to that.
Sorry, Eric, can I just interrupt? Just to let the panel know that it's 1 minute to 11. So I don't know if you want to just pause there, Eric, just for a moment, and then we'll have our 2-minute silence. And then if you could continue, would that be okay?
Thank you, Susie.
Thank you. I'll let everybody know when it's 11 o'clock. We've got a minute.
So I'll carry on for a minute. It's great that the big lottery is looking at funding for an additional year. But I think, in answer to what Councillor Walker said, I think we do probably need to think quite quickly about how we look at supporting the bits of this that do need additional resource or do need continuation resource. I spoke to Michelle a few weeks ago, and during that conversation, she did say this is not primarily about the money. This is about connection and about a network and about linking and how we make this operate. But there are unquestionably things in there that do need continued funding. The need for social prescribing will always be there.
It's 11 o'clock. Could we just please take 2 minutes to remember those? Thank you. Thank you, everyone. If we'd like to proceed, thank you.
So I think I was saying that lots of things that Aging Better is involved with supporting at the moment will continue to be needs, and the social prescribing is a good example, if you like. Social prescribing should be seen as a kind of preventative investment. It's much easier to work at a kind of I say lower level. I don't mean it's unsophisticated, but to work at a lower level with individuals earlier in their problems with isolation, depression, whatever, than it is to bring in social care or mental health resources further down the line. So that investment is important to us, and I would contend that if Michelle is saying that for the final year of the project they're getting less than half of the £1 million they normally have to support that, then for £500,000 you probably receive a thoroughly good return on investment for the work that Aging Better actually does. The Mental Health Trust TUV are envisaging a sort of 5-year legacy of mental ill health as a consequence of the first wave of COVID, and at the high end that'll be people with physical sort of neurological damage, but much of it will be about trauma, depression, and that will turn into isolation and the rest. So we know we're going to have an additional legacy of mental ill health for the next 5 years as a very minimum, probably longer than that. The role of Aging Better is fundamental in that. So I think the panel, I have a role, obviously, in my professional capacity in ensuring that the services and the value that we get from Aging Better, we find a way of continuing that. But it's doing that in a time where we do have real limitations on our finances. So the support of the panel in considering how we would do that, I would personally appreciate that, and I'm sure that would be useful. Thank you.
Thank you, Eric. And thank you everyone for observing that 2-minute silence. Any more questions for Michelle? No. Thank you, Michelle. I must say Aging Better is a great title, isn't it? We're all aging, but better. Anyway, we're going to item 5 now. Reducing loneliness and social isolation. And we've requested in relation to how COVID has impacted on this social isolation. Can we bring you in, Eric, for this, please?
I think, you absolutely can bring me in on this, but Michelle probably knows it in a way with a degree of granularity more than I do. I think. I've spoken briefly before about the work that TUV are kind of coordinating about how we respond to the additional pressure for mental health services over the next 5 years or so, and that will be work with not only service users but also staff members and people who wouldn't have normally seen themselves as being within the set of people that access mental health services, because in all sorts of ways COVID-19 and the first wave of it will have touched very, very many of us, either through our private life or through our professional capacity. So it's no respecter of stereotypical ideas about who accesses mental health support. But I mean, we can, working within social care, we've really had a glimpse, and from where I sit, it has just been a glimpse of the impact of COVID-19 in terms of the restrictions in people's mobility, the restrictions in terms of their ability to socialise with loved ones and friends, and also the suspension by necessity during the first wave of some of the kind of the statutory services that we've had in place. That people have accessed daycare in the past, and the need to suspend some of that, and of course the issue of the restriction of visiting into care homes, which has been an awful sort of necessity and still is problematic for us. I think as we go into the second sort of lockdown, to describe it as that, I think because we've learned a lot more about COVID, and we've learned about how to deliver services in a more COVID secure way, we are going into this lockdown with most of our daycare resources still operational, and we intend wherever possible to keep those resources open. We closed them first time round because it felt absolutely necessary to do that. We're being told to do that. We didn't understand sufficiently the disease and how to do it safely. But this time round, it's a little bit different. It does mean we've had to restrict some of the places. We can't run at the full capacity we did before for obvious reasons, and that undeniably has an impact on some individuals. the bit that's probably occupied my time more than anything else has been in connection with care homes and that restriction of visiting in care homes. And that has been a weighing up of a balancing of individual human rights versus the duty to protect the collective, and that is always going to be a very, very fraught sort of set of decisions to take. Where we stand at the moment, pre the national lockdown. The guidance was saying that directors of public health, and in our area, it was myself and the director of public health, needed to kind of express an opinion to care homes about the appropriateness of visiting based on the prevalence of COVID-19 in the community. And some weeks ago, we were compelled to write to the care homes saying our recommendation, DPH recommendation, was that we restricted those visits. I although it hasn't affected me close to home, I do understand the distress that causes. There were some caveats attached to that to do with end-of-life care. There always have to be some caveats attached to it. And ultimately, because of the way that registration in care homes operates, because of the role of the registered manager, ultimately what the DPH was doing was making a recommendation to care homes. The final kind of call was for the care home manager, but that's to place care home managers in a thoroughly invidious and unenviable kind of position. Where we are now, during that first wave, the government provided something called the Infection Prevention and Control sort of grant fund, and that was to invest in care homes to improve the facilities there around prevention of infection and transmission of COVID. And what we chose to do in Middlesbrough was to take some of that money and turn it into a small grant fund so that care homes could approach us and ask to access that money to provide facilities such as sort of visiting pods in gardens or covered areas in gardens so that people could visit, or additional outdoor hand washing facilities, whatever. And the intention at that point was that we would use that to facilitate visits. There have been I hate the terms, but people talk about window visits at care homes now and whatnot. They're fairly grotesque terms, but that's the territory that we had to find ourselves in. When the national lockdown, which has just arrived, came along, there was additional kind of guidance, and some of the pods and whatnot that we've actually put in, we find are not sufficient to cope with the new guidance, which has talked about visiting pods needing 2 different doors and people entering from other doors and whatnot. So we're working with the care homes in town at the moment to see what we can facilitate on a kind of care home by care home basis to see how we can arrange visiting. There will be some people who will be bedfast, and the new guidance allows us to take certain approaches to those visits. There are some people who will be able to visit with outdoor pods. There will be some care homes where it's more problematic than others, and there will be some caveats around visiting associated with end-of-life care and whatnot. So there will always be kind of discretionary decisions that have to get taken in all of this. Ultimately, it will land with the poor old care home manager to bear this heavy responsibility with our support and assistance. And we will always seek to support those care home managers in taking those decisions. But it's that balance about the rights of the individual and safety for the individual versus the need to protect the collective. I know some of the meetings I was attending at when we were kind of looking at the second wave and whatnot, it was very clear that our role first and foremost was about saving lives as far as care homes went, because we all recognise the heavy toll that we saw in Middlesbrough's care homes the first time round, without implying any criticism of care homes at all, because I'm not. But there was a heavy toll for the community and the families associated with those individuals. So as hard as some of the decisions are that we have to take, they are about saving life. And until we have a sort of reliable vaccine, that'll continue to be the reality of the situation. I think I probably talked for long enough. I don't know if there are any questions.
Okay, thank you. Michelle, would you like to add to that?
Yeah, I think just from our learning in relation to the contact we have with older people through COVID, specifically around isolation and loneliness, I think it's worth it's worth not separating out isolation and loneliness from people's other difficulties or issues. So, you know, you've got a report around physical activity for older people. That's the same issue as this. You know, supporting carers is the same issue as this. Supporting people to get access to the right benefits, unemployment, bereavement support, they're all the same issue, and they can all potentially be solved with the same solution. So what we found is people's loneliness and isolation is so wound up in things like how they feel about their physical health, the lack of access to their GP or their consultants appointments, their reductions in their mobility, their inability to see their friends and family, their volunteering position that they can't do anymore, the fact that they used to help put the chairs out in the community group that they attended, and that little thing was what they didn't realise how much it was helping them, and now they can't do it anymore, along with like really high levels of anxiety about being out in the community, catching COVID, and dying. And what we saw with our telephone befriending service particularly was a high risk of people falling over, which is why we're so interested in the fall prevention stuff. So people's physical and mental health are so massively intertwined, and we shouldn't be talking about one without talking about the other. If we can't bridge people's health, the physical health interventions with the mental and social interventions, then we'll never be able to properly do a job around social isolation and loneliness, at least not locally. The local picture is that the health inequality, obviously the physical health difficulties and the complexities of people's physical health issues are so acute in relation to, if I talk to people from different parts of the country, that we can't ignore those when we're talking about isolation and loneliness. And that, I suppose, that's my newest soapbox, I suppose, is not talking about it like it's something separate.
Anyone any questions? Councillor Rooney?
Yeah, thanks, Chair. And it's kind of leading on from where you were, Michelle, and started to think about how people are at work, because we've now got a workforce that's working from home, and the longer that goes on, the lack of motivation grows, the feeling of isolation, and we've also got an older workforce. We've got people who are expected to work for a lot longer, and I don't know whether that's being factored in or if you just, and it's encompassed anywhere, but I think that's kind of a growing thing. And then what will come from that possibly is anxiety levels about returning back to work. And going back into your place of work if you've been working from home for such a long time. I mean, some of us are lucky we can go back in and out, but I've been out of work since March. I haven't been able to go back into my office, and I'm a paid worker as well as a counsellor, you know, and just seeing how that has grown and grown and grown over the time, and just how we're thinking about that, I suppose.
I think
that makes sense.
Aging Better hasn't done a lot of work around employment or older people who are still in work, predominantly because our support is flooded by people with multiple and complex needs who either never been in work or who've never been in steady work. So that one of the reasons why we don't have a project around retirement as a trigger for something that we do is that in the main, most of our more acute services have worked with people who've been unemployed for like a long time. So Aging Better isn't touching on older people who are employed, who might be working from home, who might become lonely and isolated, because we're having a hard enough job just supporting older people who are at home lonely and isolated without any additional added sort of activity in their life, like a reason to get up and go to work or to work from home. So yeah, I think you're right, absolutely. There is issues around loneliness and isolation for the working age population and working from home. I would hope that the responsibility for that rests on their employers being able to properly support their workforce in order to keep people connected and provide opportunities for connection and well-being and all of those things. Because if you are a decent employer, that's what you would be doing. You'd be looking at that with the people that you employ. But we haven't. It's not something that's in our experience at the moment.
Thank you.
Yeah, okay, Councillor Rooney. Councillor Walker.
Thank you. I mean, I could actually look at just one person and which epitomises basically what you're trying to say, Michelle. I mean, I've got somebody near me who is actually an older gentleman now. Well, not as old as me, although I try and look after him. But he's in his late 60s. He's had complex health issues since he was 18 years old. He lives on his own. He doesn't work. He don't think he's ever worked. He's very, very isolated. He now has an even more complex health issue with dialysis 3 times a week, which is his only reason for getting up on those 3 days. He has one care worker on a Friday because he won't have anybody else in. I've tried. He fell down the stairs yesterday, and I was really concerned about it. But he's okay. But he still insists on going over to the shop on his own. He doesn't interact with anybody. Gets his little bit of shopping, masked up, and comes home. And I was talking to him about getting the stair lift. Now, this is where I mean about the mental issue as well, the mental health issue. I was chatting to him about why don't you we can get you a stair lift, we can try and get you a stair lift, save you messing about the stairs and knowing his situation. Now he said, I'm not going to be here after Christmas.
Yeah.
And that's that because he honestly believes he's wasting his time doing this dialysis. He thinks that he does not need to live anymore. And that worries me very much because I'm trying to figure out what can I do for this man now. And he is actually just one of a few people I'm in contact with. And I'm just worried about how can we bridge that? That man has never really had a lot of friends or family around him. And that he's just one of those people that we're trying to actually help. So how do we deal with that?
That sounds to me like what you're doing is really powerful and useful. Ultimately, like if you're looking at the people in his life who he trusts or who he has regular contact with, and if that is only you, then you're playing a very powerful role in that gentleman's life. And potentially you might not necessarily recognize it, but the conversations you are having with him are really useful and valuable to him, whether probably he knows it or not. All we would potentially suggest is building on that and keep chipping away, unless the guy has influenced by his GP and would listen to. So some people listen to their GP, which is why the social prescribers getting in with people, because their GP has said, you need to talk to this person. They're going to come and talk to you. And if the GP says this is what needs to happen, then they see that as more legitimacy than if a social worker or, do you know what I mean? It feels like part of the health system. But other than that, sometimes there's very little that you can do with people who have capacity to make their own choices. My granddad's been saying for 10 years he's not going to live past Christmas. He always bloody does. But yeah, it's there were lots of really sad stories, lots of sad stories out there.
Eric, you had your hand up before, Councillor Wilson. So.
Yeah, very, very briefly. I mean, some of you heard me talking about my late grandmother before, but my grandmother lived alone when she was in her 90s and had a range of health problems. But she used to reject care, and I remember living far away from there. I heard that she'd had 3 social work assessments in a row. And none of them, they'd come away with care plans and whatnot, but none of them had actually got anywhere near to what was important to my grandmother. There was lots of practical suggestions which she rejected, but actually the important thing is it's not an accident that social work's got the word social in it. It's about the personal connection that if you're working well you can make. It's about the relationship that you can build, and that's what Councillor Walker, that's what Michelle is talking about. It's about talking to that individual and actually finding out what's important to them, building that relationship with them. And only when you've got that trust there, and that means an investment of time, it's only then that you actually start to unpick some of this stuff. And that's, if someone builds a relationship with you, you're far more likely to entertain the practical supports that might go in and in turn contribute to a reduction in the likelihood of you becoming depressed or whatever. So it's always about the social and about the personal relationship. That's the beauty of the social prescribing and whatnot that Michelle's talking about.
And that was the power of COVID. We suddenly had permission to phone everybody. Never in a million years would GPs have sent through 500 patient data of 500 older patients, and we had permission to cold call patients from the practice and say, I'm phoning to check you're okay. And because we were in the middle of a pandemic, nobody had an issue with that. Yeah. And we then were able to engage people who we'd never spoken to before or who we'd never supported before, because we had permission to reach out in that way and be a really person-centered service. And we can't lose that. We have to keep being brave. on behalf of people, I think it's really important.
Yeah. Thank you.
Councillor Wilson had your hand up first, and then Councillor Rooney.
Hi, thanks, Chair. My brother-in-law lives in an independent supported living accommodation. I think it's 85 flats, including bungalows. Over the last few weeks, I've seen him sort of going downhill slightly. He's lost his appetite. He's lost his will to live type of thing. He hasn't said that, but going by his general attitude. Now, I'm one of his key workers alongside my wife. We go down there twice a week. I go down there maybe 3-4 times a week. But the one thing he misses now, he has like the youngest kids, 7, 5 and 3. And he loves them a bit and he misses them. Now, okay, we do a FaceTime when we go down, but it's not like when he sees them face to face, you can see his face light up and you see it changing him. But once them kids go and he doesn't see them for like another week or two, you can't see them face to face. It's like Eric said, it's up the manager of the home as such. Now, where he is, they used to have the bistro and the like the lounge area, which is part of the bistro where you sit and watch the telly. That's been closed down since March, since the COVID's kicked in. There's none of the residents actually meet down there. It's a desolate area. So you walk in there and it's like lifeless. It doesn't feel right. And I think a lot of the residents are actually feeling that in there. And I think that's what's dragging them down. Okay, they've got the kids going every day. My brother-in-law's got them in 3 times a day. I would imagine some of the residents in there have them 3-4 times a day. But you're seeing the same faces. You're not seeing anybody new. And I think that's it. That is a big thing to book them up and give them make them a bit of a smile. Like my brother-in-law goes out on Tuesday with PSN, Personal Support Network. That's something to do with the bubble he's already in the health worker and what have you. So he gets out once a week for a couple of hours. But the rest of the time, then he's stuck in his flat. Now, okay, he's 30 stone, so he can't walk far. He's no good for going for a walk around the building even. They've got a nice big garden. He's not going out there because he can't walk by himself. And because what's going on around him, I think he's actually, just this week alone, he started to go downhill pretty quick. I'm going down there tonight to start word and see. I don't know. I just don't know the answer to any of this. It's sad. It's hard. It's hard for everybody. But I just, like Michelle, I just don't know what the answer is. I know a couple of years ago in Stockton, we had, was it 310, I think, in Stockton and befriending service on Yarn Road. We did have something like working with that. I did signpost people to that service, and it did work. But whether that could do with something like when Brunel was in Beachfield Court, I don't know. Where they could arrange something like that, a befriending service to go in and visit these people, which would come in very handy, I would imagine. I just don't know the answer, to be honest. Thanks, Chair.
Have a befriending service.
Thank you, Councillor Wilson. Michelle, you want to respond to that? Or? It was more or less a statement than a question, really, wasn't it?
We have a befriending service, and AGK has a befriending service. It's difficult in sheltered accommodation. That we've done quite a lot of work with housing providers around activity in sheltered accommodation in those community spaces. But there's a lot of challenges to that, and all that was immediately shut down as soon as COVID hit. So it felt like quite a lot of the stuff we'd done was immediately just kind of washed down the toilet because all that momentum was lost. But there is a report on our website about our work in sheltered accommodation in those community spaces you might want to have a look at, because it talks about what works to improve the community feel in those housing providers and what it takes to get some of that stuff off the ground. But not currently, because if they're saying no one can meet in that community space from that building, there's nothing you can do.
No, that's the problem. That is a big problem. It's, we have to live with it for the time being. That's the thing.
Okay, thank you, Councillor Wilson. Councillor Rooney?
Yeah, thanks, Chair. It's just going back to some of the stuff that you said earlier on, Michelle, and because we don't know how long COVID's going to last, should we as a panel be starting to look at an update report and looking at the joined up work that you're recommending, something that will take us post 2022? Just think, if we're looking at some kind of legacy or longevity to the work that you've started and run with, and although some of that's been hampered and stalled in some ways by COVID, but that doesn't take away the need to look at how we ensure that there's something in place post funding, even if we can attract funding to keep some of the projects going. We're unlikely to get another 6 million fairly soon, are we? But thinking about that joined up work that you want to do, and I think that's something maybe the panel could consider as well, and maybe you can help us, guide us on that.
So it's worth noting that Louise Grabham, who's head of commissioning and procurement for Middlesbrough Council, sits on our core partnership. It's just that she is mega busy at the moment, as is everyone in the council. And I think one of the difficulties is that the pandemic has spread existing resources, particularly council officers, so thin that some of this work is we're driving it forward, but we can't. But not everyone can keep up because they're all doing really important things in their own actual jobs, especially if you're the council where you have lots of duty of care. Whereas Aging Better, we get to do this stuff because it's my day job. Does that make sense? So I think definitely the joined up work, and I think we need to look at the core partnership for Aging Better and see, actually, is Louise Grabham the right person? Do we need to set up separate meetings with the local authority and public health to have these conversations in a slightly more, creative way? But fundamentally, that's my job. That's my job to reach out and keep kind of pushing the agenda and keep sharing our evidence and try and bring people on board, because my role between now and next March is to do exactly what you've said. So any support from the panel around that would be really great. I don't want to undermine the role that the council has played in the programme, especially very early on. And although recently that's tapered off to an extent in terms of influence, we also understand why that's happened.
Okay, thanks. Yeah, I mean, I am concerned that we have got some influence, and maybe we can help drive that forward. Thanks.
Eric, you wanted to come in?
Simply to say, I would the suggestion that Councillor Rooney has made, I would absolutely welcome that. Indeed.
Yeah, Michelle, can I ask you a question? Sorry, Councillor Walker. When you ring people up and you identify a problem, at the moment, how can you solve that problem when you can't go and actually see the person?
Well, we can go and see them, and we've done lots of doorstep visits. Whilst the restrictions were lifted, we saw people face to face. We are still delivering hundreds of birthday cakes to older people and all of those sorts of things, and we're still delivering information to them, care packages to them, and we can still, as an organisation, see them face to face in our buildings and in some GP practices as well. In terms of help, at the moment, there isn't a huge amount of community activity still running, but there is still things that people can do safely. We predominantly focus on supporting that person in terms of listening, advocating for them in terms of their health and well-being. So we refer people through to the MDT SPA to have their physical and mental health needs looked at in a more robust way, and we've had some really great outcomes from working with the single point of access. We send them information, we find books for them from volunteers, we do all of the little nice things that help, that are very relevant to that individual in their life as best we can. Otherwise, all we can do is offer support and contact and a point in that person's week where someone's going to listen to them for an hour and care about what they have to say, which, should not be underestimated as an intervention, especially now. So yeah, we have a lot of networks and links and relationships with everyone who's doing anything in relation to supporting the community, and we utilise them as best we can.
Councillor Walker, you wanted to say something?
Yeah, thank you very much, Chair. Looking back at the previous report we did, which Michelle, you had actually been involved in at some time, which was in 2018. Yeah, you remember that, don't you?
I do remember.
When we all used to meet up. Right. One of the things that, one of the recommendations, well, a couple of the recommendations that we did do, and by building on what you actually said about it isn't just older people. One of the recommendations was that the wider piece of work be undertaken to encompass other demographics, such as the young people, when discussing loneliness and or social isolation. For example, further scrutiny of investigation by the ad hoc scrutiny panel. I don't know whether that actually happened because I can't remember. That might be something worth revisiting as one of our, Eric might have some further information on that.
Yeah.
Also, one second, Eric, I'll come back to you. because I'm terrible. I was. An awareness raising briefing be scheduled for all elected members in respect to the issues surrounding loneliness and social isolation. Now, that's something that needs to be done again, because we've got a lot of new councillors now since 2019. And I think that needs to be revisited, because a lot of people not on this panel need to be allowed to take part in that briefing. So I think that's another area that I do think we need to maybe get going on and sort out. Thank you, Chair.
If I could just respond, sorry for butting in, Councillor Walker. There was a terrific amount of work done on the joint strategic needs assessment and trying to update that, and that did look at other age groups. But I mean, I think probably COVID has. I think Michelle used the expression "washed away." I think COVID has probably washed away some of our confidence in terms of that, because the landscape has absolutely changed. So we do need to look at it in terms of broader age group. I mean, I'm part of the Ageing Better cohort now, and have been for a few years. So I think Ageing Better does, in terms of ages, spread its neck quite wide. I mean, but there is a consideration around individuals who are sub 50. There is some work going on, I think, within public health and within the Staying Put agency, and some work around social prescribing around younger people. But actually, we do need to knit that all together. And I suspect that the real opportunity to do that is when we look at the transition from the lottery funded sort of incarnation of Ageing Better into whatever it evolves into. We do need to think about how we encompass younger individuals within that. And I completely endorse your point about briefings. We've got a lot of newer councillors. There's probably quite a lot of things that they would benefit from briefings and regular briefings on. That's me.
Yes.
Thank you very much. Thank you.
Anyone else? Michelle, you got your hand up?
I'd be happy to do briefings for anybody online, remotely, or however, depending on the restrictions around loneliness and isolation. I can talk about it forever. It is worth noting that the evidence suggests that the loneliest people in the country are aged 16 to 24, or is it 14 to 24? So when we're talking not about social isolation, but specifically loneliness, we're not talking about older people necessarily being the loneliest. So it is really important to consider that, I think.
Can I just say there, Chair, that I think perhaps the Children's Social Care Panel, Scrutiny Panel, should actually take that on board as well.
Yeah, that's fine. Noted. Anybody else any questions for Michelle? Geraldine? Unmute, Geraldine. Unmute your... No, you're still not. You're still... I know sometimes it's a bit difficult, these things that don't work straight away.
Is that it?
No, there we go.
Yeah, it's just to thank Ageing Better. I've had quite a few comments from friends and older people on the activity packs that you took out, and they were all pleased. But I'd like to, on a lighter note, one of my colleagues said she made a mask out of the sock that was in the activity pack, but she was afraid she might get corns on her nose. But yes, there's been quite a few who have rang me and said they have been in touch with quite a few. We all joined up when we Thorntree Community Hub, and I think the older ones still ring me up saying, when are you opening again, so that they can be included in things that we all used to do prior March. But they're looking forward to hopefully be a part of the community that they were with Northamptonby Community Hub and Newport. But yes, they still ring me and hopefully keep in touch with them to say what's happening. But yeah, the activity packs were well received.
Well, there's more going out this winter, so we've expanded our offer. We have blankets and cookers and warmth stuff and well-being stuff and arts material and all sorts going out this winter. So
Well, I hope you don't give anybody slippers, because my friend and I got them from Walking Better, and she fell over with these non-slip slippers on. So I know.
Public health do have slippers.
Yeah. Well, she one of my colleagues got a pair, and she fell over in them. So
yeah, yeah.
But
yeah.
again, you're doing a good job. Thank you.
That's a really lovely feedback. Thank you.
Has anyone any questions for Michelle or Eric before we move on? Welcome, Councillor Hill. No. Okay, Michelle, I think you're doing a brilliant job in difficult times, and I think us as councillors would like to thank you and Eric for doing the job you're doing. Thank you very much.
Thank you for the opportunity.
We'll move on to item number 6 now. Any other urgent items? The only one I have is the report went to the OSB last week. I think it was last week or the week before. And it will be presented to the Executive Board in December for them to endorse the recommendations. So that's all I've got to add. Anybody anything to add before we... Susie?
Thank you, Chair, and just thank you to the panel for your contributions this morning. In terms of kind of the way forward, obviously we've heard from Michelle in terms of the great work that's being done by Aging Better Middlesbrough, and obviously they have extended funding now until 2022. So obviously at the moment, there isn't, I feel that writing a report to kind of see the foreseeable might not be the correct time at the moment, but perhaps we could re-look at this at a later date, maybe in a year's time, just to see what the position is, because obviously, as Councillor Rooney quite rightly said, we have absolutely no idea how long COVID is going to last for. We don't know what the impact on the community is going to be, or our older people. So if the panel would be in agreement for that, we could re-look at this in, say, a year's time to see where we are, and ask Michelle along to give us a further update on where Aging Better Middlesbrough is, and then from there we could potentially put together kind of an update report and look at kind of those partnerships and where we could go forward. Would that be agreeable?
I personally think a year is too long. I think 6 months would be better, but I'll go with what the panel think. Anybody, any thoughts on it?
Oh,
I think personally that...
Chair, sorry, can I just interrupt there? I don't know whether we've lost connection. I don't know whether we've lost the live stream. Could you just bear with me for one moment and I'll just speak with Michelle. Michelle, can you check whether the live stream is carrying on, please? You just bear with me. Sorry about this.
Checking it now.
Thank you. We seem to have lost Caroline. Oh, no, it's fine. Caroline said she's unfortunately logged out, but we're still live streaming, so that's no problem. Chair, could you carry on now? Sorry about that. Thank you.
Yes, I said that I think a year to look back on. I think 6 months would be fine. I don't know anybody else's thoughts on that.
Chair, can I just make a recommendation, please?
Yes.
Based on everything we've done this morning, one of the things we do need to do, I think, is to keep in the public eye what Aging Better and everybody is doing regarding what's available to people to help people, and the access, maybe the telephone numbers that might be available for people, and put something out that we do realise that there's a lot of issues regarding loneliness and isolation with a lot of people in the community, and to give people some kind of access to phone numbers. I'll remind people that this is available to them. Is there any way that the marketing department or the publicity department can actually put something out to give that information out per se to everybody, not just on the website, because not everybody's on the website, are they, Michelle? So, so what we've got to do is try and make sure it's across the board, that people are aware of what's happening and what's available to them in their communities. Thank you.
Michelle, you had your hand up first.
Yes, that sounds like a really great idea. In practice, it's very complicated. Our information was on the back of the leaflet that went to every home when the masks were distributed a few weeks ago. It generated 0 referrals to our telephone befriending service. I cannot stress enough, it's not about getting information to people. The people who are lonely and isolated will not respond to a leaflet through their door about loneliness and isolation. We know that already. So we wouldn't waste any money printing material to post through people's doors. Social media is great because you can access people's family who can advocate for them in relation to support available. Currently, if you want access to befriending, you could probably phone one of 6 different telephone numbers. If I linked the map to you at the moment around directory of services for older people, it's extensive and pretty difficult to navigate, and actually really hard for anyone to differentiate which one's for them or which telephone number they might ring, because there isn't a telephone number to ring if you would like help around loneliness and isolation. So that is definitely an issue. We aren't advertising our befriending service because we can't take any more referrals because we don't have any capacity. We will do in the new year when the new funding hits, but even then between now and then that's still not a guaranteed. So it's a complicated issue to try and get information to older people about services available to them, and there isn't a straightforward, or if there is a straightforward solution, we're yet to find out what it is.
Councillor Walker.
Yeah, I just want to add on to that. You know, I mean, what we ought to try and do as a community, not just to look at what's available through different agencies, but as we are as people and communities, to start looking at our neighbours and checking on them and making sure that everybody is okay. And I think that would be up to everybody. So I think maybe a publicity campaign of some kind, notwithstanding the fact that we've got agencies such as yourself and Age UK, etc., going on. I think we need to look at it as people and communities, and that's what we need to do. And I think we need to have some kind of campaign on that we should all take care of each other a bit better than what we do. And maybe I'm looking on a wider universal sort of sign on that. So I don't know. It might be possible. I don't know.
Councillor Rooney.
Yeah, thanks, Chair. To go back to your earlier comments about whether 6 months or 12 months is the right period of time, I don't really have any concerns, but I would want it to be timed where we weren't too late to access any other services or funding from recommendations, or too early to do that. And I think that needs to be borne in mind. So if 12 months from now, which is November, which would leave 4 months to the end of the project, is enough, then I'm happy to go with the 12 months. But if 6 months is too soon, then again, you know, I'd stick with 12 months. So I might be guided by Michelle and Eric on the timing of that. Thanks.
Eric?
Couple of things. It's a little bit different from what Councillor Walker suggested, but remember that with the new lockdown, we're standing up some of our help borough arrangement that we had from the previous kind of iteration of shielding. We don't really talk about shielding anymore, but the list's gone out for the clinically extremely vulnerable. So some people will be getting letters from government, and we will be operating kind of support lines. And if loneliness or isolation comes out as issues within any of those calls, then we will be feeding that into the appropriate agency, probably through Michelle's organisation. That's if it comes up as an issue, and I think there were some referrals that came through during the last kind of lockdown period. I would be slightly cheery about, so I should say there will be comms going out about that, but I would be slightly anxious about the idea of putting much more on our comms department at the moment, because they are so committed around the work on COVID at the moment. So there's something about timings there, but some kind of campaign as a community about loneliness, about isolation of you know, that's probably always a good idea. In terms of the timing, if I'm honest, I was kind of thinking probably about 9 months from now. I was kind of thinking 12 months probably leaves us not with an awful lot of time in the bag if there are things that are coming to an end around funding, and probably 6 months. You know, I'm scratching my head and I'm thinking 6 months, we're probably still wrestling with the pandemic response in 6 months. So it's about that. My head is about probably 9 months from now. I'm kind of thinking about it, that sort of order.
Anyway, I mean, I only think 12 months' time, if you're lonely, you'll be very lonely in another year's time. And that's why I suggested we have a look at it again in 6 months' time. But I'll go by the panel, whatever they decide. Anyone, any thoughts on it? No, we're coming to the end then. So do you have anything else to say before we bring the meeting to a close?
No, Chair, other than as we've lost Caroline, I will be ending the meeting straight away once you've ended it, Chair, so that the live stream will stop. And I just wanted to say thank you very much for this morning and observing the 2-minute silence. It was very much appreciated.
I'd like to thank all the councillors and to Michelle and Eric for all their input this morning. And we'll look forward to seeing you, Michelle, in 6 months' time.
Very much. Thank you.
Thank you. Bye-bye.
Thank you.
Thank you, everybody.
Thank you. Bye.
Okay, Susie.